Hello everyone. We will discuss the osteology of the upper limb starting with clavicle. Clavicle is the only long bone that lies horizontally. It is subcutaneous throughout. It is the first bone to start ossifying. It is the only long bone which ossifies in membrane. Apart from its medial end, the rest of the clavicle ossifies in membrane. It has two primary centers of ossification and it has no medullary cavity. So now let us discuss the site determination. Firstly, in order to determine the site, we have to see that which is the medial end and which is the lateral end. So the medial end, it is large and it is quadrangular in shape, but the lateral end, it is flattened supero-inferiorly. So this is quite easy. The medial end is large and it is quadrangular in shape, while the lateral end is flattened from above downwards. So let us see the position of the shaft. The shaft is divided into two parts, the lateral 1/3 and the medial 2/3. In the medial 2/3 part, the shaft is convex forwards, that is anteriorly, while it is concave forwards in its lateral 1/3 part. So this is the point in which most of the students get confused, and I will tell you a very easy way to remember it. First, I'd like each one of you to palpate your own clavicle starting from the medial end and going towards the lateral end. What did you find? Yes, we found that the clavicle is more protruding towards the anterior side, that is, it is more convex in its medial end as compared to its lateral end. So this way we can easily remember the positioning of the shaft. And the last point which we have to remember is that at the inferior surface of the clavicle, we will find a groove in the middle, which is the subclavian groove, and a tubercle at the junction of lateral 1/3 and the medial 2/3 part at the inferior surface. And this is the conoid tubercle. So this clavicle belongs to left side. Now let us compare the clavicle of the other side. Firstly, I will see that which is the medial end and which is the lateral end. This will be the medial end as it is large and it is quadrangular, and this is the flattened end, and so this will be the lateral end. How to position the shaft? At the medial 2/3 of the shaft, it is convex anteriorly. So this is the way shaft will be positioned, and the inferior surface will have the conoid tubercle and it will have the subclavian groove. So this clavicle belongs to right side. Now let us discuss some features starting from the shaft. So the lateral 1/3 of the shaft, as I told you, it is flattened supero-inferiorly. So it will have two surfaces and two borders. The superior surface, which is above, the inferior surface, the anterior border and the posterior border. The inferior surface, along with possessing the conoid tubercle, it also has a ridge by the name of trapezoid ridge. Okay. So now the medial 2/3 of the shaft, it is rounded part. So it will have four surfaces: the superior surface, the inferior surface, the anterior surface and the posterior surface. Okay. So the lateral end of the clavicle, this possesses a facet, and this facet is for articulation with acromion of the scapula to form the acromioclavicular joint. And the medial end, this will articulate with the sternum in order to form the sternoclavicular joint. This articular surface extends inferiorly for articulation with the first costal cartilage. So now let us discuss the attachments. I have already marked all the attachments. Brown color is for the origin of the muscle, the blue color is for the insertion of the muscle, and the green color is for ligamentous attachments. Starting from the lateral end, as I already told you, there is a facet for articulation with the acromion of the scapula. At the margins of this facet, there is attachment of joint capsule of acromioclavicular joint. Going towards the medial end, there is attachment of the fibrous capsule of the sternoclavicular joint all over the medial end. Okay, as you can see. And posterior superiorly at the medial end, there is attachment of the articular disc, and just as we go superior to this, there will be attachment of the interclavicular ligament. Okay. Now going towards the shaft, the lateral 1/3 of the shaft, the anterior border, this gives origin to deltoid muscle. The posterior border gives insertion to trapezius muscle. Going on the inferior surface of the lateral aspect, the conoid tubercle along with the trapezoid ridge. These will give attachment to the coracoclavicular ligament. This is one of the most important ligaments of the clavicle because the main function of the clavicle is to transmit the weight of the upper limb towards the sternum. And coracoclavicular ligament is the one which transfers the weight from the upper limb towards the lateral aspect of the clavicle, which then goes from the medial aspect up to the sternum. So this is very commonly asked question in the vivas, that what is the function of the coracoclavicular ligament, which I already told you. So now going on to the medial aspect of the shaft, most of the anterior surface, this will give origin to pectoralis major muscle. Half of the rough superior surface, this gives origin to the clavicular head of sternocleidomastoid muscle. Okay. Now going on to the inferior surface, there is this oval impression on the inferior surface towards the medial aspect, and this gives attachment to the costoclavicular ligament. As I already told you, there is formation of a joint between the first costal cartilage and the clavicle. So here is the attachment of the costoclavicular ligament. Now the remaining is the posterior surface. So the posterior surface gives origin to sternohyoid muscle. The inferior surface in its middle part, as the name suggests, has the subclavian groove. So this will give insertion to the subclavian muscle. And the point here which is most important to remember is that the margins of this groove, this will give attachment to the clavipectoral fascia. Okay. And just at the lateral aspect of this groove, there is presence of the nutrient foramen, and the function of the nutrient foramen is to transmit a branch of the suprascapular artery. So these were all the attachments of the clavicle. Now lastly, we will discuss the applied aspect. There are only two applied aspects. Firstly, that the clavicle is a very commonly fractured bone. And what is the point of the clavicle at which it is most fractured? So the point where the two curvatures of the clavicle meet, this point, this is the weakest point of the bone. So this is the point where the clavicle will be most commonly fractured. And the second applied aspect is that the clavicle can be congenitally absent from both the sides. Congenitally means since birth. And such a condition is called cletocranial dysostosis. So the main function of the clavicle is to transmit the weight of the upper limb towards the sternum. So in such patients, this function will not be performed. So what will happen? Yes, shoulder drooping will happen, and such patients will also be able to approximate both of their shoulders anteriorly. You can search Google look at the images. So this was all for the applied aspect of the clavicle. And I hope that you were able to understand clavicle better, and in the next video I will be covering up scapula. Thank you.